you for joining us for Webinar Wednesday. Today's topic is addressing MS discomfort from pain, numbness to pain. This webinar series is brought to you by Can Do MS. My name is Brianna Ghostin, and I am a program manager at Can Do MS, and I will be your moderator this evening. So thank you again for joining us. I want to take a brief moment to thank our generous sponsors for supporting this year's webinar series: EMD Serono, Genentech, Sanofi, Viatris, and Zenas Biopharma. I am thrilled to introduce our amazing speakers tonight. We have Diana Von Nelson, who is a social worker from New Mexico. We also have Dr. Jenny Fung, who is a neurologist in Louisiana. Thank you both for being here. We are excited to hear and learn from you. You have heard enough talking from me, and I will pass things over to Jenny, who will introduce our learning objectives for tonight.
Great. Thank you, Brianna, for the nice introduction. So hello, everybody. My name is Jenny Feng. I'm a MS neurologist here, actually located in New Orleans. I see that everybody's coming from all over the continent, people coming from Canada too. So it's really nice to be able to kind of talk to you guys about today's topics, which are listed here. So one, I'm going to be starting the conversation about how to become familiar with the various symptoms that MS can cause and can be very uncomfortable. And then I'm going to hand the mic over to Diana to kind of talk about how to describe these symptoms effectively to your healthcare team. And then I'm going to take the mic back to talk about treatment strategies for some of the more common, uncomfortable symptoms. Because of the time restraint, we may only be able to address, not everything, but I'm going to focus a lot on especially pain, because I see that in a lot of the questions that you guys submitted were about how to better, talk about pain, how to manage pain. So I'm going to be excited to talk to you guys about that. And then Diana's going to take over and talk about how to become familiar with the whole care team that can help. So it's not just, MS neurologists, but there's a whole team of people who can help you address your symptoms. So with that in mind, I'm going to talk about, I'm going to get started. So Brianna, if you can forward the slide. Okay, so this slide is about basically a common initial symptoms that usually patient present with either to the hospital or to the neurologist. These are the symptoms that are very commonly associated with initial diagnosis of MS. That doesn't mean that patients, start with these symptoms. So you may have had years of other type of symptom, which I will address in the next slide. But these are the symptoms that usually lead to some significant, physical disability or discomfort that's, lead people to seek help. And I'm, willing to bet that many of you probably have experienced at least one or two or multiple, of these symptoms that I'm mentioning below. So one is vision changes. So MS can cause loss of vision. And that is due to, the lesions presenting in the optic nerve, which is a nerve that connects the eyeball to the brain. And that's a very common area that can be affected by MS. And then what happens usually, patients describe, loss of vision, whether it's in one eye or maybe subsequently in the other eye. And that can be very, very disabling. Sometimes people can present with double vision, meaning you're seeing one or two. And I have some patients even telling me they see 3 or 4 things. And that is because of the MS lesions that affect the area of the brain that controls eye movement. So your eyes are not moving in sync. So that leads to double vision. So that can be seen in some people as well. And then on top of that, eye pain, which is typically, associated with eye strain of having, to adjust to these new vision changes. And on top of that, having optic neuritis, which is inflammation of the optic nerve, and all that swelling behind the eye in such a limited space can lead to pain and discomfort from that. And then you can experience muscle weakness, and typically in MS, because it's all dependent on where the lesion is. So you can experience, weakness, you typically on one side at a time. So it can be like the right arm and the right leg affected at this time, or maybe left arm and left leg affected at another time. Or sometimes as a lesion is in your spinal cord, it can be associated with a certain level. So sometimes patients tell me that they have, weakness from the waist down or weakness from the chest down, and that is because of the lesions either in the cervical or the thoracic spinal cord. And then abnormal sensations or just pure numbness or inability to sense things normally, and that can also happen similar to weakness. That can affect typically affects one side at a time as well, or below a certain level, on your trunk, depending on where the lesion is in your spinal cord. And trouble walking, that can be due to a combination of weakness, sensation, and balance issues that lead to people falling, and that's usually a common presenting symptom when patients come to the ER as well. So these are presenting symptoms, and then if you can, Brianna, if you can advance to the next slide, I'm going to talk about some of the other common symptoms that may be seen in MS, but less commonly discussed, because sometimes these symptoms are people don't typically seek care if they have just one of those symptoms, but they're certainly important because the number of these symptoms that you might experience, or the severity of these symptoms that you might experience, can vary greatly from you to the person next to you in the room, and also for just one person it can fluctuate from day to day. So today you may feel great without any of these symptoms, and next day you may feel like you have two or three of these things on the list. So fatigue, clumsiness, imbalance, dizziness, bladder problems, bowel issues, cognitive problems, pain, sexual dysfunction, mood issues, and muscle stiffness and spasms. These are very commonly seen, and usually when I see a patient in the clinic, I ask them about these, because sometimes if you don't ask, from me on the provider side, if I don't ask, patients may not think that it's important to tell, and these are all important symptoms to me. So usually I try to have a list of things I always ask each patient. So these things can be seen in MS. All right, next. So this is a slide from a group that did a lot of research, led by Helen Tremblay. She's a neurologist, and they did a lot of research in terms of the MS prodrome. And basically, the concept of that is, if you can advance to the animation. So the time of MS diagnosis, when you have, whether the vision problem or the weakness or the falls that lead you to the ER, a lot of times, if you go back and think about all the symptoms you experienced in the previous maybe month to years, you may have already had, increased fatigue, increased pain and headaches, and, anxiety issues that you never had before. So a lot of these things can be grouped together, called the prodromal period. And and we don't know when that particular period start, but we do know that can happen even before the MS diagnosis. And this is a time where, patients may experience a lot of these, what we call relatively non-specific symptoms, but later, after the MS diagnosis, then we look back, kind of like using our hindsight, and we realize that you've been suffering from MS for however many months or years before the MS diagnosis. So understanding the MS symptom is very important, both as a patient and also as a provider. We go to the next slide. And okay, so I'm going to leave it to Diana to talk about how to describe symptoms better.
Thank you, Jenny. Hi, everyone. Diana from New Mexico, but I actually work with Dr. Fung in New Orleans, and I do my work remotely most of the time. So I'm going to speak a little bit about the importance of describing our symptoms well to our providers. This is important because it can help lead to an accurate diagnosis and appropriate treatment. It helps us really focus our discussions with our providers. So for example, many of you, I'm sure, have children or grandchildren, and you know how difficult it can be when a young child comes to you clearly in pain and discomfort, but can't really verbalize or describe to you what they're feeling or what they're experiencing. It's hard to narrow it down. So when we can come to our providers with something more than "I'm in pain, it hurts," we're able to really have a really focused and effective discussion with our providers. Another reason it's important is because you want to become an expert on your experience of pain or discomfort, whatever the symptom may be, and begin to differentiate your own experience of a particular symptom. So what I mean by this is knowing when it started, when did it begin, and how long has it lasted? Has it gotten better, worse, or is it staying the same? Is it something new that just started a few days ago, or is it a chronic symptom that you've lived with for many weeks, months, years even? Or is it treatment that you've started making it better, worse, or not really helping at all? So those could be medications, therapies, a change you're making to your activity level. You can go ahead, Brianna. Thank you. So I'm sure everyone here has heard this numeric rating scale when they've been to a doctor. How describe your pain? Is it a 0 out or a 10, or somewhere in between? Maybe you've even seen the FACES pain rating scale. This is used oftentimes with children as well. And these are useful scales, but they have their limits. So for example, if 5 of us were sitting in a room together and all of us had broken our leg in exactly the same spot and exactly the same way, we would each rate that pain differently, right? Dr. Fung might say, oh, it's a 3. Brianna might say it's an 8. I may say it's a 10. It's the worst I've ever felt. And so numbers mean different things to different people. And what you rate as an 8 may not be the same as what your doctor or your healthcare provider would rate. So we want to kind of move beyond that. So next slide. So when we think about going beyond these numeric ratings of pain, we want to give more detail. So first, can you describe accurately where in or on your body you're experiencing the pain or the symptom, right? So I give the example of you have a pain or a symptom in your left leg. Is it on the inside or the outside of the leg? Is it in the front or in the rear? Is it going from the hip down, from the knee down? Is it the entire leg? And then using analogy or metaphor to help describe your symptom can also be helpful, right? So like a burning sensation in my thigh. Many of us have had at least a minor burn, and so we know what a burning sensation feels like. You might describe it as someone's poking your skin with needles. That it feels like when you're trying to lift your leg, it's like you're carrying around a 50-pound weight, or that you're having an electric shock in your thigh every time you go to lay down. So these are just some ways to use analogy or metaphor to help describe your pain or symptom. So this slide shows a lot of different ways, words we can use to describe pain, but these can also be applicable to other symptoms, right? So if you have a tingling sensation, right? Is it superficial? Does it feel like your entire muscle, deeply into the muscle, is tingling or is buzzing? So many of these words can be used to describe all different types of symptoms. And these can also be helpful in getting your medical provider to understand the experience that you're having with a particular symptom. Another way that we can effectively describe our experience with a symptom is by putting it into context, right? So thinking about what's the worst pain you've ever experienced in your life, right? So I've heard, women say giving birth might be the worst pain they've experienced, right? So how does this current symptom you're having compare with giving birth, or compare with when you broke a leg, or whatever your worst experience is? Is it worse than that? Is it the same? Is it not as painful or not as bothersome? The current symptom you're having, whether it's, urinary urgency, a visual symptom, pain, when was it at its worst, and how does it compare now, right? So is it as bad as the worst time? Is it better? And then thinking about too, we're not just thinking about the severity of the symptom itself, but how bothersome it is to you. So if it's lasting longer, or if it's getting in the way of you doing things that you need or want to do at home, when you're socializing, being active, working, or if it's a symptom that's affecting other symptoms, you may think it's more bothersome now than even when it was at its worst in terms of severity. So just to give an example of this, many folks with MS experience heat sensitivity, and it's possible that your heat sensitivity may change with time. And so maybe it wasn't quite so bothersome to you a while ago, but maybe now it's bothering you more because it's causing the weakness you experience on one side to get worse much faster, which means you can't be outside as long, you can't enjoy certain activities. And so it's really important to be able to describe that to your provider as well. Another thing that you want to do when thinking about your symptoms is to be able to think about how they affect your life on a day-to-day basis and to track that. So noticing how the symptom changes throughout the day. Is it worse or better at different times of the day? Is it interfering with certain activities like walking, standing at the sink to wash dishes, but not with other activities that you might be doing? What's making it worse or better? Do you notice that if you change your position, that alleviates some of the pain or makes it worse? Does temperature have an effect on your symptom? Another thing to keep in mind is that, especially with chronic symptoms, but also with acute symptoms, they can begin to have an impact on our mood, our energy, our motivation, just our general desire to do things in life that bring us pleasure or a sense of accomplishment. And so it's really important to talk with your providers about any uncomfortable symptoms that are having an effect on your mood and your motivation and your desire to do things that you enjoy doing. And then lastly, the duration, right? Is this a constant symptom that you have all throughout the day? It never stops, maybe goes even into the night and disrupts your sleep. Is it intermittent? Is it sporadic? Is it occasional? Does it last for hours when you have the symptom, or just a few minutes, or longer than that? So there's a lot of different ways that you can track your symptoms and describe them. I mean, many of us just write it down on a piece of paper and bring it to the doctor's office. I think now with our smartphones, people will record little reminders into their phones, or they will type up little notes in their phones. There's also various apps specific to multiple sclerosis, and I've given an example on the left-hand side here, which is from the Multiple Sclerosis Association of America. And this is the, I think it's called the My MS Manager app, and you can download that. There's a book that I was able to find called Track Multiple Sclerosis, and it's really more like a one-year journal where you can note your symptoms, any changes to your medications and so forth, keep track of appointments. But really, you don't have to complicate it. You don't have to spend money. Just learning how to track it, describe it, note how it's affecting your functioning. These are really important things you can do. So just want to take a minute. I'm not asking people to vote on this, but you can certainly, respond in the chat box if you want to. I think it will become kind of obvious, but just wanted to give some examples of patients who are describing their pain to their provider. So we have Sandy who comes in and she says, I'm in so much pain. My body hurts so bad that I can't do anything. I'm miserable. I just want it to go away. Nothing works. And then we have Tawanda who comes in and says, I'm in a lot of pain. It started about 3 days ago while I was weeding the garden. I noticed a sharp pain in my low back, and now it's less sharp, but more gripping and achier. It's constant, but walking and standing make it worse. Sitting decreases the intensity by maybe 20%. I took ibuprofen, but it doesn't help at all. So I think we can see that Tawanda's story, as Jackie said in the chat, and so did others say, it's providing a better description, right? It's giving much more information to the provider. And then we have Jackson. So Jackson comes in saying he's having trouble with urinary incontinence. He has an urgency to go at least 10 times a day. If I wait until I feel that urgency, I can't make it to the toilet in time. It's worse when I drink caffeinated drinks or when I'm having a stressful day, and it's worse in the morning and afternoon. And then Martin comes in with the same problem. I'm having trouble with urinary incontinence. I have to go all the time. I'm so sick of this. It's embarrassing. So while some of what Martin's telling us is important, it's really important to know that it's having an emotional impact. He's feeling embarrassed and clearly frustrated. Obviously, Jackson's description of his experience with urinary incontinence is much more descriptive, much more useful for a provider. And so I'll pause here and hand it back to Jenny.
Great. All right. I've been trying to answer some questions in the chat box, but I think some of your questions I will also be able to address in the next couple slides. So there's because this is a very kind of an overhead view of all the various treatment strategies to address MS symptoms. So this is very different than, MS disease modifying therapy, which are to prevent, new attacks, prevent disability worsening. But if you already have these symptoms, there's many different ways that you can treat to basically improve quality of life. So for a lot of my patients with weakness and gait difficulty problems, therapy is super important. So if you have a good physical therapist who is familiar with MS-related neurologic deficits, then that's worth, they're worth their weight in gold. Because having a good physical therapist who can guide you on, trying to train those muscles that are weaker, because you will need to put extra attention to the weaker side or the weaker muscle group, and to develop, specific exercise programs that are fit for you to continue on the long term. So this is very different than, patients who just go to, maybe some non-specific center, stay on the stationary bike for 30 minutes and call it a day. That's not the physical therapy I want patients to get. I want patients to get very specific, neuro-based physical therapy that actually target the problem. And then on top of that, there's a lot of adaptive and assistive devices that can help you walk better or use your, arm or leg better. For many of you may be familiar with, canes, rollators, wheelchairs. There's also power wheelchairs. There's a lot of different adaptive devices that can help. And then some of you guys may even be familiar with neuromodulator devices, and that's, things like the, the Bioness or the Psionic sleeve or other, neuromodulation attachment that you can wear on specific muscle groups to basically help those muscle function, more efficiently. And then also, consulting with like an occupational therapist may be helpful to modify your home environment so that you don't have any falls or injuries because of your, weakness or gait difficulties. That's also very important. And the various, MS societies may have different types of funding that can help you, help you in terms of acquiring equipment needed to make your home safer. So for pain, I'm going to focus a little bit more time on this because that seems like a very common problem that many of you may have. So there's many different types of pain. So like Diana was mentioning in her previous slides, to describing the pain as, precisely as possible really helps the provider in determining, making the treatment plan for the pain. Because pain from MS, it can be different than pain from joint pain, can be different from muscle pain, can be different from, migraine attack, and can be different from spinal stenosis. So describing the type of pain is helpful to basically figure out what's best to do. Because if you have nerve pain, which typically feels like, like a sharp electric shooting like sensation, like zinging sensation, or some patients tell me it feels like, like a burning or needle prickling sensation. So for those type of nerve pain, usually an anti-seizure medication, such as gabapentin or Lyrica or Lamictal may be helpful, because what they do is they kind of slow down the nerve conduction speed. So they make those hyperactive nerves less active. So in return, you don't really experience the pain because of those medications. And antidepressant medications such as Cymbalta or Effexor can also be helpful in controlling pain, because what they do is they change the the brain chemistry so that you're less so the neurotransmitters responsible for pain are less, basically they reduce the amount of that in your brain over time. So, and sometimes you may need a combination of anti-seizure and antidepressant medication to target nerve pain. And then for muscle pain, there's a lot of different techniques. So you can do in terms of pharmacologic, medications like muscle relaxers, such as baclofen, Xanaflex, tizanidine, and also, non-steroidal anti-inflammatory medications such as naproxen, ibuprofen, or Tylenol may be helpful for muscle pain. And on top of that, I mentioned a lot of different medications. The downside for medication is that every single medication, unfortunately, has side effects. There's no medication without side effects. And then that leads us to, non-pharmacologic management. So physical therapy can be helpful with pain. And also, depending on whether you have muscle pain or nerve pain, heating or cold packs may help, because muscle typically relax with heat, and nerve pain typically may improve when the temperature is a little bit colder. So, and depending on what type of pain you have, you may be able to utilize temperature to help address the pain. And sometimes patients may need, topical creams. So some of the creams that you apply to certain areas where you have a lot of pain may be helpful. And then pain management is an important partners in care for addressing pain that may need interventional approaches. And on top of that, wellness approaches is super important, because if you're living in pain, it's unlikely to get your pain completely down to a 0 out of 10, just kind of setting realistic expectations and using wellness approaches to, one, address, if there's any triggers such as stress that may worsen the pain, and also doing stretches like, yoga, like Pilates, that can really help with some of the neuromuscular type of pain. So there's a lot of different management outside of just simply medication. And I see somebody asking a question about topical creams. There's actually many different kinds. So there's capsaicin cream, where it actually burns a little bit when you put it on, but over time they may help you be more numb. There's lidocaine cream, and a lot of the compounding pharmacies can compound like gabapentin, but in a powder form, along with some capsaicin, and then with some other, numbing ingredients into a cream or a lotion form that you can apply. So there's a lot of different options. And some of my patients, they tell me about the things that they find. And usually I look up the ingredients and let them know whether it's okay or not to take. So definitely talk to your, MS specialist about the different creams that you find, and they can help you determine whether it's going to be helpful or not. And then for tremors, some of you may experience that. The treatment for tremors is very similar to some of the other, non-MS related tremor conditions. So beta blockers may be helpful for tremors that are kind of similar to essential tremors, and anti-seizure medications may be helpful for some of the more stubborn tremors. Usually when I have patients who have persistent tremor despite, the base, first and second line level treatment, I refer to movement clinic for evaluation, because some of you guys might benefit even from, deep brain stimulation. But I would say MS tremor is notoriously hard to treat. So this might require a multidisciplinary approach between your MS doctor, between the movement clinic doctor, and occupational therapist. And there are assistive devices that you can use too. So I actually borrow some of this from, patients in the Parkinson's world. There's, weighted utensils that you can use to help facilitate eating without spilling your food. So those are really cool innovations that we borrow from other subspecialties. All right, next slide, please. And fatigue, that's also a major one. I would say it's probably one of the most common MS symptoms. And there's some studies that looked at, just looking at how many MS patients have fatigue, and that can be up to 70 to 80% of the patients that report that. And again, MS is only one of the cause for fatigue, so it's really important to work with your provider on looking at other conditions that may affect fatigue. So, in terms of other medical comorbidities such as inadequate sleep, whether you have an ongoing infection or not, whether you have thyroid problems or not, if you have anemia, you're also going to have fatigue as well. Certain vitamin deficiencies such as vitamin B12 that can be associated with fatigue. So figuring out other things that can contribute to fatigue can help treat it because those conditions are very treatable. And then on top of that, have a good run through your medication list because there are many medications that have fatigue as a side effect, especially in MS world, a lot of the muscle relaxers, a lot of the, the nerve pain agents, they have fatigue as a side effect because that's what they do. They calm down the nerve, they calm down the central nervous system pain receptors, and in return, you have fatigue because you feel drowsy. So let's definitely look through your medication list to make sure that everything that's on your list are with things that you absolutely need, and remove things that don't really help you and cause fatigue as a side effect. And then aerobic exercise. Oh, sorry, if you can go back to the slide. Yeah, aerobic exercise is very important because just like athletes, you want to keep moving to build your endurance because, I'm sure many of you have experienced if you've become inactive for like even just a couple of days, then it's going to take you weeks to kind of get back to your previous, activity level. That's because our body deconditions very fast, but it's slow to recondition it back. So maintaining some level of, physical activity daily can help with fatigue in the long term. And then energy conservation techniques. These are basically looking at your day and saving maybe the most, physically arduous tasks for the morning when you may have the most energy, and saving the more sedentary tasks for later. Just kind of planning out your day accordingly once you have a better idea of how your fatigue changes day to day and also within the time of the day. For some of my patients, fatigue is worse when they're in the heat, especially right now in Louisiana, or, we're living in 90s to 100 degrees outside temperature with the high humidity. Cooling vests may really help with that. There's cooling vests, there's also cooling scarves, cooling hats. For women, there's maybe cooling bra inserts that you can wear. So there's a lot of things that you can do to help combat the heat. And I tell everybody, if you have to do walking exercise, maybe do it in the mall when it's air conditioned, because it can take you like a couple of days to recover if you're overheated and you have fatigue and pain as a result. Lastly, for medications, there's no FDA approved fatigue medication, unfortunately, for treat MS, but we use a lot of medication off label when everything else when patients have failed everything else. So to start, there may be something called amantadine that we borrow from the movement disorders world that can be helpful. And then modafinil is a neurostimulating medication that may help. And then antidepressants, there's some activating antidepressants that may help as well. Dalfenpridine is a walking drug that helps patients basically walk faster by changing how the nerve transmits energy, and that can in turn help with fatigue too. So we use that off label as well. And then lastly, amphetamines such as, Focalin, such as Adderall. These are the medications that we usually try to use with caution because first of all, they're not, FDA approved to treat fatigue, but they can also have, a lot of different, adverse outcomes and side effects. So I usually say that as kind of like a last resort when nothing else helps. So, all right, next slide. Okay, and then there are some other symptoms. I'm gonna, in the interest of time, I'm just gonna briefly mention them. For sexual dysfunction, again, a lot of the medications, especially the antidepressants category, may have sexual dysfunction as a side effect. So make sure you discuss that with your provider if you're experiencing this. And then, treating pain. So a lot of patients may have like spasm, nerve pain affecting their sexual function, and that can be treated. And patients may need vaginal lubrication, pelvic floor therapy. So these are the things that definitely discuss with your MS provider, and then they might rope in other medical care team to help you address this. And also libido issues, there's many different options as well. So usually I refer patients to a urogynecologist or the gynecologist to talk about different medications for men and women. Bladder dysfunction, there's many different types of non-pharmacologic management that you can actually find on the Can Do MS website and many of the other vetted, MS Society websites. There's many different things you can do without taking medication. And if it gets to a point where you actually need some medication, there's medication to, depending on what symptoms you have, there's medication to relax the bladder, there's medication to actually increase the bladder contraction rate. There's medication to help the bladder to communicate better with the outflow sphincter that lets out urine. So there's many different options. And then urologists also can do, interventional procedures as well if none of the other things above helps. For vision, usually if you have optic neuritis, you might have trouble seeing in the dark. So there's a lot of low vision adaptations that you can do, such as the ones I listed there. And then there's also a really great resource called Lighthouse for the Blind. They also have a lot of really helpful information on their website and resources for you to look into if you have a vision problem due to optic neuritis. And then occupational therapy can help, again, with the safety measures that you need to do in their house, and also when you're out and about on how to, navigate the world with low vision. And then usually I have, neuro-ophthalmologists and optometrists as part of the healthcare team to work with me for patients with vision issues, because there may be other things affecting the vision, such as, glaucoma and cataracts that are, not MS related, but that can also affect vision. So next slide. And treatments for mood changes. Again, there's counseling is super helpful. Diana is actually also a counselor that sees a lot of my patients. And then so talk therapy, behavioral therapy, and then whether you want to also see psychiatry for medication management. That's something to be discussed as well with their MS provider, because MS patients do have a higher rate of mood changes compared to patients without MS. And that may be like depression or anxiety or some other, psychological issue. And then for cognitive dysfunction, which might affect a lot of patients. And then, so medication side effects is one of the main first things I look at, because there's a lot of medications that actually make people feel drowsy, and in turn they can't really function in the, in today's world, which is a very demanding of us. We need to multitask and do many things fast. And if you have MS, that makes it hard to really navigate that world already. On top of that, if you have a sedating medication, that may make things very hard. So looking carefully at all your medications, again, making sure that you're taking each one and they have a known benefit and they have minimal side effects, and eliminating those where the side effects are just too much for the minimal benefit that they bring. And they evaluate for other medical comorbidities as well. So because cognitive function is not just due to MS, and there's many other things that can affect us, such as sleep issues. If you have a family history of neurocognitive disorders, such as Alzheimer's and Parkinson's, you may be at higher risk for having cognitive dysfunction. So that having a thorough discussion with your MS provider about your medical history is important. And many times I do send patients to the neuropsychology department for a formal cognitive evaluation. Then that can be very helpful for determining whether your cognitive dysfunction is due to MS or something else, or is it a combination of many different factors. And then, if it turns out that your cognitive dysfunction can be helped with rehabilitation, then I refer patients to cognitive rehab therapy, which in the case of my current healthcare system is administered by speech therapists, but there's many, other medical professionals who do cognitive, rehabilitative therapy. And lastly, I tell patients, regardless of whether you have cognitive dysfunction or not, always be on the lookout for, learning new skills, being curious about the world, reading, maybe the news can be depressing these days, by reading, new books, reading, different articles, engaging with people, and that can really help stimulate your brain. Because these are the things that you should be doing anyways for cognitive health, regardless of whether you have cognitive dysfunction or not. All right, next. And lastly, lifestyle changes, which is something that, again, regardless of whether, whether you have any of the symptoms that I discussed already or not, these are the changes that you should incorporate anyway, because they're good for overall neurologic health. So in MS specifically, in terms of diet, there's a tons of evidence for Mediterranean style diet, because this diet kind of focuses on limiting sugar and processed food, which we know can increase inflammation, and increase your intake of fresh fruits and vegetables and lean proteins such as fish, and chicken. These are, and avoiding red meat and avoiding just a lot of sugary snacks. These are this is a diet with a lot of evidence, not just in MS, but also in the Alzheimer's world, also in, headache world, stroke world. This diet has been proven to be just helpful in general for neurologic health. And supplementing vitamin D, if your vitamin D is low, is also something that you should, address with your MS provider too. Exercising, whether it's, gait training, balance training, stretching, it really doesn't matter as much as what you do, as opposed to doing something on a routine basis for long term. Because whether you're doing, cycling, or whether you're doing floor yoga, these are the things, just having movement 20 to 30 minutes a day over time, that can really help increase your flexibility and increase, basically preserve your muscle mass. And because, over time, whether you have MS or not, you lose muscle mass. So, any activity that keeps you moving, and if you can incorporate a little bit of resistance training, can be body weight based training, that can help you preserve your muscle mass and against the the progression that some of you might experience. There's a lot of chair or floor-based exercises for my patients who may have balance problems or gait problems. Then you can do things while lying down on the floor or sitting in the chair. And aquatic therapy, I really like that too, because a lot of the pools are actually heated, so they really help with tight muscles and spasms that may accompany a hard workout. So, all right, next slide, please. And wellness approaches, I think many of you are already familiar with this. I'm not going to read the slide for you, but these are the things that, again, you should be doing, regardless of whether you have any of the symptoms that we talked about or not. All right, next slide.
Okay, yeah, thank you. So I'll pick up here. So I won't spend too long on these slides, but this is just kind of thinking about the people on your healthcare team or within your healthcare system and beyond, who can help you with your uncomfortable symptoms. So obviously your MS specialist, I hope many of you are actually connected with an MS trained specialist. And they're going to be the most knowledgeable about the common and less common MS symptoms and how to treat them. And they're going to be able to help you differentiate when what you're experiencing may not be related to MS. And so when you're having a symptom that maybe isn't connected to your MS, they can help begin an assessment for you, maybe doing MRIs, X-rays, some other type of evaluation, or just getting you referred to a specialist who might be able to help do a better evaluation. And then there are symptoms that, of course, are connected to your MS, like urinary symptoms and visual disturbances. But your MS provider may not be the best person to treat those, so they may refer you out to another specialist. If you are lucky to be at an MS like comprehensive care center or a specialty clinic, an MS nurse is going to be able to triage your phone calls and messages to your provider. They're going to help assess what's going on and maybe help you to more accurately describe what you're experiencing before that gets relayed to your physician. As Dr. Fung mentioned, and I saw some folks talking about in the chat, seeing a mental health provider, a therapist, behavioral health, whatever you want to call it, a counselor, talk therapist, these folks can help you to talk about and manage the emotional and even some of the physical aspects of your uncomfortable symptoms. We do this through a variety of modalities and skills, but some of the common things that we use with folks when they're having discomfort would be breath work, learning to observe the thoughts that we have about pain and uncomfortable symptoms, and maybe challenging ourselves to think a little differently about that, using mindfulness education and training, and then providing treatment for other conditions that are affecting and can be affected by pain. So if someone has underlying trauma, if they have high anxiety or depression. We want to help get those better managed because that will absolutely have an effect on how they experience pain. A pain medicine specialist, of course, this is a person whose whole specialization is in treating pain and discomfort. And so they may be more comfortable prescribing medications that an MS provider or a general practitioner is not so comfortable prescribing. They also do a lot of specialized assessments of pain. I'm actually shadowing in a pain clinic this week, and folks that are going through a special program, they have complete like 10 different assessments about pain, some of which I didn't even know existed. So they can really do very thorough assessments around pain. They can perform other types of procedures, some that are minimally invasive, like nerve blocks. And then they may also have within their clinic physical and occupational therapists, social workers, or other mental health therapists who are specially trained in treating pain and from a holistic perspective. Other folks on your healthcare team, not every healthcare system has access to all of these, but some do. In fact, I saw some folks commenting in the chat that they get these services maybe free through their MS center or for a fee through their MS center. Massage therapists, acupuncture or acupressure therapists, a pharmacist. And so I think the first two kind of speak for themselves, but a pharmacist. Pharmacists, I've had folks that I see for counseling tell me how pharmacists have helped them identify maybe other medications that might be worth trying or that might have a better side effect profile for them. Assistive technology professionals or ATPs, these are individuals who work at adaptive mobility equipment vendors. So here it's places like NewMotion. I know NewMotion, National Seating and Mobility. And these folks are trained to help assess individuals for the types of mobility equipment they need that tend to be a little more specialized. So custom manual wheelchairs, custom power chairs, and making sure that those devices are really fitted for you, for the symptoms you experience, and for the needs you have, which can then reduce pain and other uncomfortable symptoms. And then orthotic and prosthetic specialists. So these are folks who might help you to be fitted for a standard or a custom type of brace or splinting that can help alleviate discomfort and pain. There's also rehabilitation specialists. I'm sure many people on the webinar tonight have had experience with physical and occupational therapists, even speech therapists. So these are folks who are trained to assess, proper body mechanics to help reduce pain and discomfort and the likelihood of future injury. As Dr. Fung mentioned earlier, there are certain therapists who have also been specially trained in treating neurological conditions. And so it's really important to seek out those folks if you have them available to you. That's a very different treatment approach than someone who broke a leg and needs to be rehabbed after breaking a leg. PTs and OTs can also make recommendations for making your environment more accessible and more comfortable. And they can also create and help guide you through a home exercise plan or a plan to use at a gym that you attend, which is really important. We really want to keep folks moving, even though they experience pain, but to do it in a way that works well for them. And then other medical specialties, I kind of spoke to this earlier, right? But some of the common ones might be a urologist to manage urinary issues. They can better manage chronic UTIs, which of course are painful. They're more equipped to manage incontinence that's not responding to certain medications. We have a number of folks here in our clinic who have more than one autoimmune condition, and so they may get referred to rheumatologists to diagnose and treat those conditions. And then a physical medicine and rehab specialist or PMR specialist. So this is a doctor whose focus is really on treating your condition to help you become more functional, right? To be able to do your day-to-day activities more easily. And I think that's it for us.
Yes, so that will take us to our Q&A section. Thank you so much for the amazing information that we have received so far. We have been receiving a lot of questions in the chat, as well as people sending in messages. So one of the questions that we got was, how do they differentiate between their pain being from MS or from older or new injuries? How do they know if it's a MS or if it's from older injuries?
Yeah, I think that's where what Diana mentioned about describing your pain really comes in handy, because you know, for MS pain, typically you know, it could be either nerve pain or muscle pain, versus, you know, pain from some kind of physical injury that's going to feel very different. You know, whether it's like, you know, you torn a shoulder or you have like spinal stenosis, those are very different in terms of, one, the pain quality, two, you know, what triggers that pain, three, the things that make the pain maybe better, and also how did you get that pain to begin with. So those are the very important questions to consider when somebody comes to me and telling me that they have a new type of pain. That's what I'm trying to decide. Is it MS pain, or like is it maybe many other things that cause pain? So describing it well can really help me. Also, you know, a neuro exam will be very helpful in determining that as well.
Okay, one of the other questions we have is, anyone experiencing foot pain, specifically toe pain, what are some treatments or suggestions for that?
Sorry, could you repeat the question again? Was it you were mentioning something about experiencing tingling?
Yes, experiencing foot pain, specifically in their foot or toes.
Oh, okay. Yeah, no, and again, it could be like a MS problem due to, you know, nerves damage in the spine or in the brain, or it could be actually like a, you know, a foot problem, because people can have feet injury that lead to toe issues as well. And on top of that, you may have muscle cramps too, that if you have, you know, nerve damage, that may subsequently lead to muscle cramps that cause toe pain. So I would definitely, you know, recommend like having your MS doctor do a complete physical exam and determine what's the cause of that first.
And then we have, does pain always have to hurt? Are there any types of pain with symptoms other than just hurting feelings? I am thinking of a headache or a migraine. Headaches can be painful, but migraines don't always come with pain.
Yeah.
Are there other symptoms besides pain?
Yeah, I mean, there's many, there could be like just a simple discomfort, and that might not be what you care. And again, each person characterizes pain differently too. So something that I might think is painful to another person may just be more of a, you know, soreness. So just, you know, pain, it's such a subjective term. So that's why I think describing it rather than just calling it pain, it's helpful to let the people who are trying to help you understand what is it exactly that you're experiencing. Because it could, like you said, it could be a sharp pain, or it could be more like a pressure squeezing like sensation, or it could be, you know, a deep, you know, like bone type of pain. So those are all different type of descriptions. So the more words you can use to describe, the better it's gonna be helpful for your healthcare team.
Anna, was there anything you wanted to add to that one? I know you talked about how to describe it.
No, I think Jenny did a great job. Thank you.
And then the next question we have is how to deal with heat affecting legs and symptoms.
Yeah, no, heat sensitivity is something super common. So there's really no medication you can take for heat sensitivity, but a lot of it is, you know, basically trying to adapt and figure out, you know, how your body responds in heat. So limiting your time outdoors, you know, when you just read the weather, and there's like a UV index that you can follow, humidity that you can track on your phone, that basically tells you. So avoiding spending as much time as outdoors as you can, but on the times you do have to spend outdoors, you know, a lot of shade, like a big had, those sun umbrellas that some people have that can help block the sun, which can help, cool things down at least by a couple of different degrees. And then a lot of the cooling devices that are available. I think some patients also link some URLs in the chat about this. Oh, there's so many different companies that make cooling devices. And also, if you haven't utilized the various societies that offer cooling device assistance, because you may qualify for free device that are supported by grants and funds through those societies, but definitely talk with your MS provider about all those different opportunities, because before you go on and buy some expensive cooling gear.
And then we're getting a lot of questions about magnesium cream, specifically what it helps with.
Yeah, magnesium cream, yeah, it's a great option, I think, for people with muscle cramps and spasms. I have patients who actually take oral magnesium to help with muscle cramps. That also may help with sleep. And then there are patients who use like a magnesium rub that they do on their leg, and then magnesium cream. Basically, I think it helps the most if you have tight muscles. If you're experiencing spasm, muscle tightness, Charlie horses, those are the things that magnesium may help with, because anything related to muscle tightening, that's magnesium can be, I would say, low risk. If you do take oral magnesium, be careful about diarrhea and loose stools. But the magnesium cream, they're kind of low risk, and I haven't really had patients who report back any type of adverse effects after using them.
And then we're getting a lot of questions also about numbness. Is there anything specifically that helps with numbness?
For numbness, it's tricky because numbness is the absence of sensation. So there's no medication that we can give to bring that sensation back. So I think with numbness, that's really hard to treat. So a lot of it is based on focusing on basically adapting to living with numbness. But if you have more what I call positive sensory phenomena, which means you have like abnormal sensation, that's easier to treat, because that's usually means you have a hyperactive nerve ending that we can try to calm down with either different types of medication or non-pharmacologic measures. But the absence of sensation, it's hard to bring something back once you've lost that sensation. But like I said, a lot of the wellness measures is really important, because you want to maintain the optimal nerve health. So if, let's just say you have like 10 nerves, and 3 of them are out because of MS related or something else related, and you have 7 healthy nerves trying to do the work of 10. So you really want to make sure those 7 nerves remain as healthy as possible. So a lot of the wellness measures are really important. Maybe not for the short term, not for any immediate effect, but they're helpful for you 5 or 10 years down the road. Yeah.
Thank you so much for answering those questions. And unfortunately, we didn't get to answer all the questions that we have. But we would like to thank you for joining us for our webinar Wednesday. Please stay connected with us. I'd like to take a moment again to thank our sponsors again, our generous sponsors, and thank both our speakers for today for their well knowledge. We do have our next webinar will be next month. We'll focus on DMTs, and that will be September 10th. Please, we hope to see you there. Thank you again for joining us. There will be a survey that will pop up at the end of this. We would love to hear the feedback from you and any information that you have, as well as hearing some topics that you may be interested in. Thank you again for joining us, and we would love to hear your feedback. Have a great night, and thank you for joining us for our webinar Wednesday.